Good morning, everyone. I can see everybody's like hopping on here at the last minute, 7:30 on the dot. So it's time for us to get started with our presentation. Thank you for joining us. My name is Becky McGregor. I'm your Employee Wellness Coordinator, and joining us today from Presbyterian Health Plan is Philip Anaya. He's going to be presenting your plan benefits for Presbyterian today. We also have Andrea Biggs in the chat box. She is our benefit specialist, just one of our wonderful benefit specialists, and she's going to help answer questions in the chat box when they arise, should they arise, or if it's something we can hold off until we get to the Q&A section. We'll also have Ann Johnson in the chat box and to help you with questions. I am going to just cover off on a couple of things since we're going to move into this pretty quickly. Please, as you enter in to the meeting, make sure that your phones and computers are muted. It just provides less distraction for everyone, including our presenter. And also, if you can, turn off your camera. When we get to the Q&A section, please put your questions in the chat box, and we will address those questions, okay? Again, we have our benefit specialists, and Sheila Jaramillo just joined us. She's a supervisor over benefits and leaves. We're going to try to address things, some of them as we go, but some of them specifically for Philip. So we'll be getting to all of those, I promise. But please just put those in the chat box. And let's see. Also, let's see if while we're in the Q&A section, we might just ask you to unmute just to clarify your question. And if we do so, then of course, we want to make sure that we answer all the questions fully. And I'm moderating, so I might, if a mute button accidentally, gets unmuted, I'll make sure I take care of that as quickly as possible. But without further ado, I want to introduce Philip to you so that he can get going with his presentation. And I will stop sharing my screen so that Philip. Are you ready, Philip?
Yes.
Okay. So Philip is going to share his presentation with you. And again, we will address all your questions as we go, or not as we go, but in the Q&A.
Yeah, as we go along, I think I'll answer most questions that people might have, at least some of the common questions. So we can go through the presentation, get those out of the way, and then if you have something really specific or something that I didn't address, we can definitely go through those as well.
Great.
So can everybody see my screen okay? So just let me know if you have trouble seeing my screen or if you have trouble hearing me.
I think that the screen looks good today.
Okay,
yeah.
Awesome.
Thank you. Thanks, Richard.
So Becky mentioned, my name is Philip with Presbyterian Health Plan. So hopefully here to provide you with some useful information with regards to Presbyterian in general and some of the changes that you can anticipate for 2021. So I like to start off with this. This is a really good visual. I myself am a very visual person. So the picture on the left, are obviously a bunch of different tools that just lying around, and then the picture on the right is a Swiss Army knife with all of your tools kind of put together into one unit. So this is kind of, for me, sometimes a visualization of healthcare. So sometimes you're not sure where to go, what to do, who to call, and that's kind of the picture on the left with all of those different tools lying around. You don't know really what tool to pick up and what tool to use, what lever to press, what button to push. So hopefully with Presbyterian, you don't experience that. And our goal is to kind of put all of those pieces together for you so you have all of the tools in one centralized location. So again, just kind of a visual for you. So if you choose Presbyterian, I can guarantee you there are going to be numerous ways that you can use Presbyterian, especially with technology advancements. There are so many things that you can tap into without even leaving your home. And we'll go through some of those specifically here in a second. So we're going to talk about some quick care items, quick care things you can tap into and use every day. some additional low-cost or no-cost services that are available to you and your family, and then highlight some better care just in case, because maybe you're not, going to the doctor a whole lot and you're pretty healthy, but it's kind of nice to know what you have available to you just in case you might need it, right? So quick care for everyday ailments, getting the care you need when you want it, very important to most people, I would imagine. We have our 24/7 nurse advice line. Sometimes people forget, and it's nice to know that this could be a very good starting point for you. So you can always pick up the phone and talk to one of our nurses. These aren't nurses in a different state or a different place that you're calling. These are nurses here in Albuquerque that you're actually talking to, and that still work in a clinical setting. On average, they have about 10 years of experience, so they can provide you with guidance, home remedies, kind of point you in the right direction. In addition to that, you have 24/7 video visits. So instead of talking to a nurse, now you can use your smartphone, your tablet, your computer, anything with the webcam to actually have a visit with a provider 24/7, 365 for you or anybody that's covered in your family. We also have online visits through our website. Just to clarify here, this is a little bit different than a telehealth visit you may have with your actual doctor. This is a smart tool that you go into and you put in all of your symptoms, and then they help with a diagnosis and treatment plan. And if it's something that cannot be addressed online, they'll schedule an appointment for you. And then, of course, my chart. So if you've ever been to one of our facilities or seen one of our doctors, my chart is your portal. It's an app you can actually download onto your phone or tablet, and you can communicate with your care team, with your doctor, schedule an appointment, request that refill on the medication that you're taking, pay a bill, see your test results. A lot of times you'll be able to see your test results before your doctor even sees your test results, just because everything's uploaded real time for you. So take advantage of these ways to access care and tap into the technologies. All of these things are available to you at no cost, so they're free. So why not tap into them, especially if, if you're not trying to go out and you're staying home right now, or limiting your exposure. These are definitely things you can use. Some additional services that we just want to highlight and talk about that are a little bit newer, one of them being Talkspace. So Talkspace, I don't know if anybody's seen the commercials or the ads, but there's a really good one with Michael Phelps, and he's obviously known for being a great Olympian, but he admits that sometimes he needs somebody to talk to, or he has issues that he's trying to overcome. So Talkspace is a way for you to tap in to this service and actually speak to a therapist. And again, this is available to you or anybody in your family. We find that it's very appealing to millennials or a younger generation, just because, let's admit they're always on their phone anyway. So if they can actually utilize their device and talk to somebody about their problems, and it's a service that you can trust, it's an actual licensed and credentialed therapist, a great way for them to access care. And again, you don't even have to leave your home to do that. Clicatine, another resource available, and an app that you can download, and it helps you or anybody that's trying to quit tobacco products, whether it's chewing tobacco or cigarettes or e-cigarettes. They have some really interactive tools on the app, and it helps follow and guide you to at least cutting down or getting to the point where you can quit, offering some resources, whether it's gum or patches. We find that with the app, being that it's interactive and it kind of has a little bit more accountability built in, it's definitely something that has a higher success rate. So if you've tried quitting before, I would recommend this again and give it a try, see if it works for you. On to Better Health is also available, and this is just an online repository of different tools that you can tap into. You'll first fill out a questionnaire asking you about different things in your life. If you have trouble, let's say, for example, sleeping, then this tool is going to provide you with some resources to with better sleep health, and videos and information on how to get better sleep and what to look for or what to talk about with your doctor. So again, some very good resources available to you. And on top of that, just like everything we talked about before, all of these resources are free. So you don't pay any co-payments, you don't pay anything towards your deductible, and you don't have to leave your house. So at the very least, if any of these pertain to you or you think you can utilize these services, they're free. You can tap into them anytime, day or night. Talkspace, highly encourage you again, if you think it would be beneficial, if you want to try it out for you or anybody in your family, just go to talkspace.com/PHP. Once you go there, you'll be able to put in your information. It'll validate that you're a Presbyterian member, and then you actually get all those services for free. So PresNow, moving on, I'm sure most of you at this point have seen these facilities. If you're not aware of what they are, the first facility was on Paseo and San Pedro, and the second one is on the west side across from St. Pius on Western Trail and Coors Boulevard. So these facilities are they're 24/7 urgent and emergency care facilities. So the really great thing about this is there's no guesswork. They automatically assume that you're there for urgent care. That's your starting point. So if you go in, you get triaged and then you get screened. If your situation for some reason turns out to be more of an emergent nature, then they'll notify you at that point and they'll treat you as if it was an emergency. And these facilities are equipped to handle emergency care and provide all of that immediate attention that you may need. So, if maybe you thought it was heartburn, but it's actually signs of a heart attack, you don't have to guess because you'll only pay for what you're being seen for. So if you're treated for urgent care, you pay for urgent care. You pay your urgent care copay. If you're treated as an emergency, you will pay for that emergency and pay the emergency care copay. So again, really nice combined facility, just takes the guesswork out for you of the equation. And it's the only 24/7 urgent care option right now in Albuquerque. 2 more facilities coming. The facility on the corner of Isleta and Rio Bravo is under construction. And then the 4th facility will be somewhere near Uptown on that side. So when you log into the website, just trying to make things really easy and straightforward. Because again, sometimes you just don't know what to do or where to go. And this example, when you go to the website and you're looking to get care today, you can actually choose a condition. You can choose your insurance. So let's say you don't even have Presbyterian Health Plan and you have a different insurance. You can actually select that on our website, and it'll still guide you to some resources that are available and in network for you. In this example, I chose Animal Bite. So let's say you did have that and it's something that you're dealing with. The recommendation is for you to go to urgent care or to one of the PresNow facilities. But on top of that, you can still call the nurse, the PresRN, the nurse advice line, and speak to a nurse and get some advice. So really nice tools available just to kind of guide you and point you in the right direction. And then additionally, with everything going on with COVID, if you have symptoms of COVID or anything of that nature, there's some additional resources available to show you about testing or where to go or what to do. So better health outcomes, just in case, we're going to highlight some things for you. And most importantly, which I'm sure you're all waiting for, we're going to talk about some of the benefits that have changed for 2021. So what has changed? Right now with Presbyterian, there's a new plan design that's being implemented for January. So no more 3-tier plan. The three-tier plan is going away for the Presbyterian option, and you will now have what's called an exclusive provider organization. I do not expect you to remember that. You will not be quizzed on that. It's just the type of plan that's being offered to you, or what's called an EPO plan. Basically, it's a little bit more straightforward, easy to understand, has one level of benefit, so you no longer have to guess whether you're seeing a doctor or going to a facility in tier 1 or tier 2. Do I have to pay the tier 1 deductible or copay, or tier 2 deductible or copay? You just have one level of benefit to look at and to understand. One deductible, one out-of-pocket maximum, and we'll highlight that here in a second. So along with that, there's no elective coverage outside of the Presbyterian network. So what that really means is that our extended national network through, if you were aware, it was through our partnership with Multiplan and PHCS. So that was just our national coverage outside of New Mexico and the bordering cities. You no longer would have that accessible to you electively. But if you are traveling or have somebody out of state and you run into a situation where it's an emergency, or you go to the nearest urgent care, even if that's out of the country, you're always covered for emergency care and urgent care, no matter where you go. So most people don't travel for elective procedures, and you get all of your care here, and that's fine. And you're really only concerned about being covered if something happens. So you still have that coverage built into the plan. You just don't have elective coverage outside of our network any longer, starting in 2021. Unless it's unique and you get that prior authorization, it would have to be approved. Honestly, there are just some services that we don't provide in New Mexico. So if you need a heart transplant, it's likely that you might need to go to Colorado for a heart transplant, or Arizona or New York, just because we don't do heart transplants here in New Mexico, and that's always going to be covered. So just keep that in mind. You still have the same network of doctors here to access, including access to UNM Medical Group and UNM Hospital. That's still covered in network under your Presbyterian plan. In addition to that, we have expanded our network, and we now contract with Optum. So if you're familiar with Optum, they were formerly ABQ Health Partners and DaVita. They are now actually in network with Presbyterian. So if you were to see any of those primary care physicians or specialists at Optum, you would be covered in network and pay your in network copayment, just like you would if you saw any other doctor with Presbyterian. Most importantly, and I think a lot of people have shown interest, is the Fitness Pass. So the Fitness Pass, which is the gym benefit, you now have access to with Presbyterian, and we'll dive into some specifics here. But for 2021, with regards to the plan, here in the first two columns, you can see the benefit, the current tier 1 benefit and the current tier 2 benefit for your plan today, which is the 3-tier plan, right? The third tier is just if you were completely out of network, which doesn't really apply to most people, very, very small percentage of people. So, and then on the far right, you have the benefits for the new 2021 EPO plan. So if you were to just compare and look at, the most important things here that people look at, which is your deductible. Before in tier 1, as a single person, your deductible was $250, $500 for 2-party, $750 for a family. Tier 2, that went up to $1,500, $3,000, and $4,500. But now for 2021, it kind of falls in the middle. So it's kind of a blend of the tiers, if you will. You can see that your deductible now would be $500 for a single person. For 2-party coverage, you're looking at $1,000 deductible. And for family, you're looking at $1,250. So still the lowest deductibles and copayments and out-of-pocket maximums that you can get with your coverage through APS. But it has gone up from what you may have been used to with your tier 1 benefits. Coinsurance, you would still pay 20%. For certain services that require you to pay a percentage, you pay 20% and APS pays the other 80%. Out-of-pocket maximum, think of this as your safety net. So this is the worst case scenario. If you're really, really sick, or something happens, you're in the hospital for 2 months and that hospital bill ends up being $1 million. The most you would ever pay for medical expenses, now this doesn't include pharmacy because that's a separate bucket through Express Scripts, but the most you would pay for medical for a single person is $4,000. So again, you could be in there for quite some time or have a lot of different services and care. But once you reach that $4,000 out-of-pocket maximum for a single person, all the rest of your coverage is paid at 100% for the remainder of the calendar year. So that's your safety net, and everything gets put into that one bucket for you. Primary care used to be a $15 copay under the tier 1, 25 for tier 2. Now we're looking at 20, and then your specialist is going up from $40 to $50 for a specialist visit. All of your preventive care, whether you go in for your mammograms, flu shots are out now. If by chance you're going to see a provider for that and not going to the pharmacy, that is all covered at 100%. You don't pay anything for that. All of your routine screenings and colonoscopies, things of that nature, physicals, are covered at 100%. Urgent care, 50, and then your emergency room copay is going up from $250 to $350. So again, emergency care and urgent care is always covered no matter where you're traveling to. So these are just a few of the highlights of what's changing for next year. There's more detail in the plan documents with regards to some of the copays and other benefits, but hopefully this gives you some perspective and an idea of what to look forward to for next year. Fitness Pass. I know most people are pretty excited about this, and it's now available to APS members. So this is something that you actually have to take action on and you would have to sign up for. So it's not automatic. So if you are interested in the Fitness Pass, you would be able to sign up, and it would be at a cost of $12.50 per eligible member per month. So we like to think that it's a pretty reasonable rate, considering that you can go to multiple gyms and you're not limited to any one location. So enrollment for this is open year round. Actually, if you're a current Presbyterian member, you can sign up today. If you sign up today, your coverage is effective the first of the following month. So if you sign up in September, your coverage starts October the 1st. If you sign up sometime in October, your coverage begins November the 1st. But once you do sign up, you are committed for the calendar year. So there's no coming in and out of the program. Once you sign up, we ask that you commit to the program for the remainder of the calendar year, unless for some reason your medical benefits term, then at that point, your Fitness Pass would also terminate. You must re-enroll every year just to make sure that you still want to continue the program. So every December, you'll be given an opportunity to sign up again for the Fitness Pass for the upcoming calendar year. It provides you access to every Defined Fitness location, which seems to be one of the more popular venues here in town. Overall, you get access to over 10,000 different fitness facilities and recreation centers. There's the Prime Fitness Network. So there's kind of these three components. You have Defined Fitness, you have the Prime Fitness Network, which is a network of gyms, and that includes Choose, Planet Fitness, the YMCA's, some of the Snap Fitness locations, just to name a few. I believe there's actually about 40 different gyms in Albuquerque that you would be able to go to. And then with sports and wellness, that is actually provided at a discounted rate. So if you're familiar with sports and wellness and what the cost is for their membership, you would be provided with a 50% discount for membership through sports and wellness. So Again, the great thing about this is you're not limited to one gym or one location. So if you want to try out the different ones, you can. If you want to go to Define Fitness today, and then you go to Choose tomorrow, and then after that you go to Planet Fitness because it's closer to your work or your home, you can actually try all of them out. And that's the great thing about the program. So to sign up, you simply go to our website, the phs.org/wellness, or just go to the phs.org website. You'll log in. If you have not created an account before, you'll register for your MyPress account. You'll click on My Health Plan, and then you'll see a button that says Fitness Pass. So from there, it'll have your information. You can select if you want to enroll just yourself or anybody else that you may have on the plan. So you can opt in for anybody over the age of 18. So maybe you have a spouse, or maybe you have a son or daughter who's 18 or 20 or 21, and they're covered under your medical plan. You can also enroll them into the Fitness Pass, and then it's $12.50 per person. And then you put in your information, whether you want that to be taken out of a debit or credit card, or your bank, if you want to put in your savings or checking account information, and then that'll just be deducted at the last or during the last week of each month. So very exciting. I know we've always been asked about this for APS, and now it's an option that's available to you. So switching gears a little bit, want to just highlight and talk a little bit about community health workers. Their name is very, very, very literal. So they really are community health workers. They're advocates for you, and they can tap into many, many resources. We've actually had a pilot with APS for some time, and it was so successful that we've rolled it out to other groups and accounts. So, they can help you with multiple things. If you have issues within the home, whether it's regarding food insecurity, or maybe you have an elderly parent that you're taking care of, or maybe some concerns about behavioral health or mental health, they can guide you and point you in the right direction. They can assist with appointments. They can actually attend appointments with you. There's so many things that they can do to assist. We've had so many success stories. So if you think something like this would be beneficial to you or any of your coworkers or somebody, I highly recommend that you reach out, give them a call, or send them an email. Just so many different things it can help with. One example, we had a gentleman who was kind of down and out and had some issues with his vehicle. They were able to tap into a resource with the local church, and they got his vehicle fixed for free, and they helped him get new brakes. They've helped people apply for services through PNM, for bill assistance. All of those little things that you may not think about but overall really affect you in different ways and really truly affect your health, they can help you out with. So I'll get off my soapbox with this, but it is a new program that we have available to you. And if you think it could be beneficial, I highly recommend that you reach out. So all in all, we talked a little bit about that toolbox. So you have these different resources and different things you can tap into. Some are at no cost, so you can access from home very easy. But at the end of the day, it's nice to know that what you can tap into if you really, really needed it. So if you were really sick and had to get lots of care and services, Presbyterian, a longstanding relationship here in New Mexico, actually born and raised here in New Mexico, voted some of the best hospitals, whether here in Albuquerque or regional hospitals, top cardiovascular facility, which many people don't know. We don't have a standalone heart group or cardiovascular facility, but that is actually built into our hospital. So you have all of those specialties available to you, and our relationship with MD Anderson. So we have one of 3 satellite locations outside of Houston, where we provide top-notch cancer treatment and solutions. So these different things you may not think about, but it's just really nice to know that these are available to you should you ever need them, right? So again, those tools all together, we're not just your insurance, Presbyterian Health Plan. We're also the hospital. We may also be your doctor. So all of these different things kind of tie in together to serve you in the best way possible. So we're locally owned and operated, headquartered here in Albuquerque, New Mexico, and we're not for profit. So all of the additional revenue that we have at the end of the year, we're able to reinvest into the community, expand our facilities, provide more services, hire more doctors. We're not on the stock exchange, and we don't report to investors. So it's kind of nice to know that we're able to put all of that back into the community to better serve you.
Okay.
So I hope you learned a few things. I know I'm probably up on time, Becky, but
I know we've got questions.
Sorry.
I know it's great information. It's great information, and just for you guys, we always joke whenever we have meetings with Philip that he should have he has a radio voice, so he's especially at 7:30 in the morning. So we have a lot of really good questions in the chat box, and so Richard asked. He had two questions about. He likes his doctor at New Mexico Heart Institute. I think you just mentioned this, and his eye doctors at Eye Associates, which is actually a different non-medical benefit. And he asks how much it would cost for him to continue to see them, and his child can his child continue to go to UNM, and how much will that cost?
Yeah, so UNM is still covered. That's in network. It would pay depending on the services. If you have an office visit with a specialist at UNM, you would just pay the office visit copay or the copay to see your primary. Eye Associates is covered under the Presbyterian plan from a medical standpoint. So if you're going for a medical diagnosis, and you're seeing an ophthalmologist, which is a medical eye doctor, versus an optometrist, we do have a contract with Eye Associates, and they are covered. New Mexico Heart Institute is not in network with Presbyterian. So that would be a change for you because those providers and those doctors at New Mexico Heart Institute would be considered out of network.
Okay, thank you so much.
Sure.
And then Catherine asked, if my son goes out of state, if my son goes to college out of state, will he be covered under Presbyterian?
So there would be limited coverage. So if your son goes to college out of state and you have him covered under the Presbyterian plan starting in January, he would only be covered in the case of an emergency or need for urgent care. Outside of that, any elective care would not be covered. He would have to have that done here locally or with one of our contracted providers. So if you're looking for that that full coverage out of state, then you probably want to look at one of the PPO plans, like Anne mentioned, the Cigna PPO or the Blue Cross.
And so for your information, that presentation is at 11:30 today, which I have a slide to come up for that. And Blue Cross is at 3:15. But thank you, Philip, for.
Sure.
And just going down the list of questions, you guys, these will be recorded. They will be available on the APS YouTube channel, Expect Great Things. And the PowerPoint that Philip has will be on our main open enrollment landing page. I've given that link a couple of times. And then we had Lynette made a comment. She went to one, and I think Anne addressed this, that not all Pres providers. She went to one of the urgent care facilities, and they weren't all Pres providers, and would it add additional charges from a third-party provider?
So if you ever run into that scenario, sometimes they have what's called a locum provider, which is kind of a provider that just kind of fills in whenever somebody's not available. If for some reason you ever get a bill that looks strange or a charge that doesn't make sense, that may be the case. That's very unusual with Presbyterian these days, But if you do, just give us a call, and we're able to help adjust or address that, because you should only be responsible for the appropriate charges for that visit, whether it's urgent care or emergency.
Right. And Sue made a comment, Sue Strom, on a slide about no out of network. How is that covered? So Sue, if you want to just unmute really quick and kind of clarify your question, if you're talking about out of state, I think we did cover that with what is actually covered under Pres out of state. But I want to make sure we clarify if you had an additional question to anything that was an out of state type of coverage question.
Well, I did. Okay. On one of the slides, it said, if you sign up for the fitness pass, it goes into effect the next month, the first of the next month. But on your slide, you said if you sign up after the 15th of the month, then the next month you'll be billed twice. So it was kind of a conflict right there. It's like, how does that work?
It's just a timing issue with the billing, because you pay a month in advance. So if you sign up after the billing cutoff, then, like, let's say today, if you sign up, you're not going to be billed for October. So in order to catch you up with the billing for the fitness pass, you'll be billed for October and November at the same time.
At the end of November.
Correct. Just because, actually, the end of October, just because you missed the billing cutoff for September, so you would have to pay for September for the month of October, but you wouldn't be given that opportunity. So with the billing cutoff in October, you're paying for both the month of October and the month of November.
Okay, but I thought you said when you sign up, your membership starts the first of the next month. So
It
if I
does.
sign up today, which is the last day of September, I would have to pay for the month?
Well, if you no, if you sign up for today, actually, that's a very good example. So if you sign up today, your coverage will start tomorrow. Now, there's a little bit of a timing issue with us getting that information to the gyms, and we may have to manually do that if you really want to go tomorrow. But you do have access for the month of October. You're just not going to be billed for October till the end of October, in which case you'll also be billed for November. But you'll have access to the gym or to the fitness pass for the month of October to start.
Okay, I'm really sorry, but I'm still confused. I thought I pay monthly at the end of the month. Am I paying a month in advance?
You are.
Okay, got you.
Yeah. You're paying a month in advance.
Okay, thank you.
That was great. Thank you, Susan. Very good question, because it does get kind of tricky with that timing. Vince Case had a great question. How do I determine if my current providers are contracted with 2021 Presbyterian EPO?
So, and Vince, I don't know if you want to add to that, but Vincent, our network here hasn't materially changed. So if you're already seeing a doctor that's contracted with Presbyterian and you're getting those services, that's not going to change for you. Really, the biggest difference for us next year will be what you have access to outside of New Mexico with our national network. And then, of course, you have the addition of Optum.
I hope that answers your question, Vince.
Yeah, thanks for answering, Philip. So I put an example in the chat, but we live in the East Mountains, and our providers are with Duke City. And so, we're wondering if Duke City's contracted with the Presbyterian EPO for next year.
Yeah, are you on the Presbyterian plan today?
Yes, we are.
Yeah, so if you're seeing them today and they're covered, they would still continue to be covered for next year. So that's not going to change for you.
Okay.
And I'm looking them up now, but yeah.
Okay. And I just wanted to clarify something for you, Ling. I haven't put the PowerPoint up on the webpage yet. We were waiting for the webinars to, we have to do the webinars first, and then we'll put the information on the webpage, and they get uploaded onto the APS Expect Great Things channel. Y'all just give me a day. Just give me a day. You guys are on it.
Yeah, and the Duke City website, it still indicates that they're contracted with Presbyterian, along with multiple other carriers like Molina or True Health, Blue Cross. So those contracts aren't going to change for you.
Yes, thank you. And then I believe Janet's question was asked, how much is the insurance going up? And those rate sheets are posted on the aps.edu human resource benefit page. So you can see that, those rate sheets, if you want to go check that out. And I will put the link again in the box. And then Kristen asked, is there an option to have a child under 18 added to the fitness pass?
Currently, no. Right now, the limitation for the fitness pass is anybody over the age of 18. And currently with our contracts and with legal liabilities involved, that we have to limit it at that age. I know a lot of gyms offer memberships for people under 18, but right now with the fitness pass, you do have that limitation. But if things change, we'll definitely communicate. But as it stands right now, you would have that limitation.
Okay. You're welcome. And Melissa asked, if we're already on Pres and we have to add a dependent, when will they start to be covered? It's kind of a two-pronged question if you want to start that, Philip.
Well, they would be covered as soon as they're effective with us, but then I'll let Andrea or Sheila or Anne address the enrollment process.
Hello, it's Andrea. And Melissa, if it's a qualifying life event where your dependent has just recently lost coverage, we would be able to get your dependent on sooner. So let's take that off this presentation and go ahead and give me a call. I do handle the last names that you fall under. So my phone number, I had listed it there, and go ahead and let's talk offline, okay?
Okay.
Thank you. Thank you, Andrea. Let's see if we have another question. Oh, this was a really good question. I'm sorry, Rebecca. I wanted to make sure we got this. Is Mayo Clinic in network?
So Mayo Clinic, they were part of our national network, and they currently are part of our national network. Whether it's the Mayo Clinic in Arizona, in Minnesota, and I think there's one now in Florida. They would not, today they're covered, but starting in January, you don't have elective coverage at Mayo, just because, as we talked about with that national network and the change in the benefits, that's no longer an option. But if you were referred to Mayo for specialized care or some sort of transplant that could not be performed here, usually in that case, you get prior approval or what's called a prior authorization. And as long as that's approved, you can still go there, but you would have to go through that process beforehand. There's not automatic coverage involved with going to Mayo anymore. Which you may want to check with Cigna and Blue Cross and Blue Shield, because they may have Mayo in their network automatically. So if you're trying to compare, now is a good time to do that, just depending on what your needs are.
Okay. And I'm going to present. I think we have hit the question. I'm just gonna, I'm gonna kind of roll forward, and if anybody has a question in the chat box, I'll make sure I wrap that back around, but I'm just gonna wrap us up here. And I want to first thank everyone again for attending. My slide just, well, I had the webinar schedule up for you guys, and somehow it moved. But 11:30 we have Cigna. Noon we have True Health. And at 3:15, Blue Cross Blue Shield, that's today. And then tomorrow is our financial wellness webinars. We have 7:30 ASI Flex, 11:30 Newsenda, and noon the education plan, 3:15 the standard. So sorry about that. I don't know. These little Google monsters, they're in the machine. I don't know what happened. But let me just give you this quick little reminder that all the information on open enrollment is on an open enrollment landing page. I've given it to you a couple times in that chat box. There it is again. We also just want to remind you that all your rate sheets, comparison grids, the payroll, when I say a rate sheet, I mean the premium payroll deduction sheets, comparison grids, and then pretty soon all the plan summaries, as well as the plan summaries, the individual summaries are going to be on that aps.edu employee benefit page. Open enrollment is completely online this year. It's in your Winocular workspace system. I don't want anybody to stress out about that. They've done a wonderful job making it very intuitive and simple for you. We are still going to have some webinars with a little tutorial to walk you all through it. Those are Monday the 5th and Tuesday the 6th. And the links to join those webinars are on that open enrollment page in that Google Calendar that's there. We have a wellness walkthrough event on Thursday and Friday at Bonifacio from 8 to 3. So this is a completely mask wearing, hand sanitizing, socially distanced preventive health service event. We are going to be offering vaccinations, mammograms, and blood drive. Now with the mammograms and the blood drive, the sign up links are on that open enrollment page for you to make an appointment. Vaccinations don't require an appointment, but we do ask that you come prepared by filling out the consent forms that are provided for you on that open enrollment vaccination page, and also bring your Express Scripts plan card or your medical plan benefit card if you're covered under a different employer. It gives you an example of how to get your Express Scripts card if you don't keep it in your wallet. That's all on that vaccination page, okay? And if after you attend a webinar or watch a tutorial, for open enrollment online, if you still feel like you need assistance, we are going to have laptop stations there with our benefit specialists to help you in that Winocular system. Again, I think you're going to find if you just tap into one of those webinars or even look at the small little tutorial that we do already have on that open enrollment landing page, I think you'll find that it's not going to be very difficult for you. It's actually going to be very time efficient. So I think y'all are going to be excited about that. Due to the public health order, please do not come to City Center. We can't help you here, but we can help you at Bonifacio if you need it on Thursday and Friday between 8 to 3:30. And we're raffling. You guys are winners just for attending because you got to hear all of this wonderful information from Philip. But we're also going to raffle for prizes, and I have a list of the attendees already recorded, and I will let you know if you've won a prize. So I want to thank you all again for attending this presentation. It really does help to hear it and get your questions answered. So we just appreciate you taking your time out of your morning. And with that, I'm going to wrap up. And I don't see any more questions. So that means I think we did the job.
All right. Thank you guys so much. I appreciate your time. Have a good day.
Thank you, Philip. Thank you, everyone.